Those couples who are trying for having a child, they should at least try for 2 years, and then if they are not able to conceive a pregnancy, healthy pregnancy, then they must consult a good infertility specialist. In Lifeline, we have all the facilities which is available in the world right now. We have a complete team of fertility specialists, IVF specialists, embryologists, and scientific directors. Then we have a genetic lab exclusive with all the international technologies and international scientists. So those who want to have a pregnancy, they can come and do a basic investigation and a scan, and then they will come to know like which both the partners has some problem or only the male or the female, and equally both the partners has to be treated, then only you will get a successful pregnancy. Usually if the pregnancy is not able to achieve normally, then we have to do a ovulation induction, or still if it's not happening, then we have to go for intrauterine insemination, which is called IUI. The success rate of IUI is only around 10 to 15%, and if there is tubal patency, still they have to try, and if it's not happening, then it's basically we can do a diagnostic hysterolaparoscopy and see the tube or uterus, endometrium, everything is okay, ovary is fine, any additions and all, then they can clear. And if the patient is having a polycystic ovarian syndrome or endometriosis, those things has to be corrected, and again they can try naturally ovulation induction or IUI. And again, if the pregnancy is not happening, then there is something called unexplained infertility, or there will be small problems like the count morphology will be bad, or egg quality will be poor. Those patients or patients who are going into premature ovarian failure, those patients can try in vitro fertilization, which is well advanced. So the success rate is almost 40 to 45% in vitro fertilization, where we do in the ICSI, IMSI and all these things comes under this procedure. So we can get a good embryo which is a blastocyst, and then we can transfer back into the uterus. The success rate is very high when we compare to the normal pregnancy or till IUI. And those couples who wants to have a healthy child, they can do a genetic screening of their baby and make sure that baby is chromosomally normal. And those couples who are carriers of any diseases like any genetic disorders like SMA, Down syndrome, or couples who has a history in their family of any genetic disorders, or blood cancers like thalassemia, sickle cell anemia, or breast cancer, all these couples, they have high chance of recurrence. And also those couples who has a repetitive abortions, implantation failure, those all couples, they can do their embryo check, where we can screen the embryo, we can diagnose the embryo which is having genetic disease, and then we can transfer the embryo which is disease free, so that the couple can achieve a healthy baby which don't have that disease, and that disease will be taken out from their family tree. And again, once they become pregnant, we can do a non-invasive prenatal testing at as early as 9 weeks of pregnancy, so that the maternal blood is taken, and in the maternal blood we will see the fetal DNA, the whole chromosomes from 1 to 23, all the pairs of chromosomes will be seen, and make sure that the chromosomally baby is normal. Or we can again do an amniocentesis or a CVS and make confirm the pregnancy is healthy. So my advice to the couples who are trying for pregnancy is, don't waste your time, because age is very important, mainly for ladies. Women, the quality of eggs is connected directly with their age. Why? Because the egg has a mitochondria, and this mitochondria, as age progress, it goes into arrest. So once the quality of mitochondria comes down, the quality of egg comes down, and the chance of having a healthy pregnancy, healthy baby is very difficult. So the age in Indian population or Asian population, more than 35, the quality of eggs drastically comes down. For some ladies, there is a condition called premature ovarian failure, also polycystic ovarian syndrome, endometriosis. All these leads to the decrease in quality of the eggs. So they have to try for pregnancy. Don't waste your time. Come, do a basic test and then make sure everything is fine, and then go for the treatment what is suitable for that couple. For each couple, the treatment modality and the scenario and the protocol is different. So according to each patient or each couple, please do the right treatment and achieve a healthy pregnancy as early as possible. All the best. Thank you.